So when you talk about treatment options for prostate cancer, again, you're always going to weigh cancer control, or what is the cancer control of whatever treatment you're looking at, and you're going to weigh that against the side effect profile. One of the most common side effects in dealing with any kind of prostate cancer treatment is looking at erectile dysfunction. Now, knowing the risk of erectile dysfunction is very complicated. A lot of it depends on where you are before you even have treatment. Are you having excellent erections? Are your erections already suffering? Are you already having trouble or on medication for erectile dysfunction? So much of that plays a part in that. An erection is also, it's a complicated event. It starts in the brain. It involves the spinal cord. It involves the nerves. It involves the vasculature, the blood flow to the penis. And everyone is different. So when you look at erectile dysfunction, one is it's tough to know exactly how each person is going to respond to any given treatment. But there are some generalities that we always discuss. Usually with better cancer control treatments like surgery and external beam radiation, there is a higher rate of erectile dysfunction. And that happens because when you do those treatments, yes, you're doing whole gland treatment, you're doing high energy treatment that can involve these neurovascular bundles. So in the case of surgery, there may be 30 to 80% risk of erectile dysfunction. In the situation with external beam radiation, anywhere from 20 to 70% chance of erectile dysfunction. Brachytherapy, 25 to 50% chance of erectile dysfunction. Proton beam therapy, 20 to 40% chance of erectile dysfunction. Focal treatment, just treating this cancer, even that has some risk of erectile dysfunction, which is estimated somewhere between 20 and 30%. And then watching cancer, you would think watching cancer, that won't affect my erections, but because there is some anxiety associated with active surveillance, sometimes that anxiety is what can often cause guys to have loss of erections. So even with watching cancer, you can notice some change in your erectile dysfunction. But it's important to note, any treatment you decide to do for prostate cancer, there is some risk of erectile dysfunction. Every treatment is different in its risk. Again, it's important to talk to your treating doctor, get their opinion, and have your questions answered regards to your erectile function after whatever treatment you decide to have done.
Are there ways that you can prepare before surgery or treatments to help your erections, or not really? And then if you do have erectile dysfunction, what are your options after treatment?
Yeah. So I believe there are ways to improve your erections prior to surgery or prior to treatment. And a lot of it is based on overall health. Because erectile dysfunction is often related to your heart health, your body health, what you put in your body is incredibly important. Lowering your stress levels, stretching exercises of the pelvis, which can improve blood flow to the pelvis and the penis, can be beneficial. Smoking is probably one of the greatest risk factors for erectile dysfunction. So in patients that are smoking, nicotine is a known vasoconstrictor, and what it does is decrease blood flow to the penis by 30%. So no doubt there are factors that can be changed or mitigated to help with improving your erections after any treatment for prostate cancer. Now, there are many medications for, in addition to behavioral treatment or improving your body health and wellness, there are medications like Viagra, Levitra, Cialis. oral medications that are effective in improving erectile dysfunction. So these are oral medications. There are injections that can be given. Penile injections, and what they do is improve blood flow and cause erections. There are suppositories, or there's a urethral suppository that can be placed into the urethra that then dissolves into the tissue and improves blood flow. So that's called a urethral suppository. And then there's vacuum pump, vacuum erection device that actually can be placed over the penis, and blood flow can be pulled out to improve erectile dysfunction. So if you do have erectile dysfunction, there's many ways to improve your function afterwards. If this stuff is not effective, then usually the next step is what's called inflatable penile prosthesis. And this is where surgically inflatable rods are placed to a device, hit a button in the scrotum, push fluid through here to give yourself an erection artificially, again with an inflatable penile prosthesis. It's a surgical procedure, but it's something that can be done. And when you look at something as serious as prostate cancer and look at treatment for prostate cancer, it's helpful to know that there are things that can be done to improve your erections after treatment.